We'd like to welcome you to this workshop, which takes place during the Geneva Health Forum and which is organized by the IFMSA, so the International Federation of Medical Students Association, and by Health for Future Geneva, an association in Switzerland which promotes planetary health for the medical students and for the community. For this video, the group sessions have been cut, but we hope that you will appreciate the presentation's content, and we are looking forward to hearing your feedbacks. Have a good video. We would just like to do a little introduction on what global changes are and what planetary health is, because I don't know if every one of us here knows this. So we will show you a series of pictures, and we would like you to pay attention to the emotions that come through you when you see them. So this is New York in 10,000 before Christ. This is in 1524. This is in 1845. And in 2021. These different environments have nothing to do with one another. Our environment is changing at a phenomenal rate. But is that really a problem? Because indeed, 100,000 years ago, Homo sapiens emerged from Africa and adapted to the different climates and conditions they encountered. Genetic and epigenetic changes are continuously occurring, and we could therefore be reassured that human and non-human species have have always adapted. That's the nature of evolution, and we will be able to do so in the face of this new rise in temperatures. But not really, because human activities are changing our planet at an extremely rapid, irreversible, and exponential way.
And just before continuing the presentation, this was designed for Swiss students and in Switzerland. So when we use our human activities, let's not forget that it's overwhelmingly due to rich countries' imprint on environments. You may have heard of the Anthropocene. This is the period since the Industrial Revolution, when human influence on the biosphere has reached such a level that it has become a geological force with a significant global impact on Earth ecosystem. This small graph shows us that several terrestrial trends due to human activities, and what we can see is that all of them have an exponential evolution over only a few decades. And now we will ask the question, what are the most important impacts of human activities on the environment? The big star is climate change. Currently, we have reached an average increase of global surface temperature of 1.2 degrees since 1850. This will result in an increase in extreme weather events linked both to a lack of precipitation, such as heat waves, drought, melting ice, and fire, as well to excessive precipitation, which in turn led to flooding. This warming is 100% due to human activities related to the release of greenhouse gases, mainly produced by the combustion of fossil fuel. The second most important crisis, often overshadowed by climate change, is the extinction of non-human species, considered as the sixth mass extinction. It is different from the first five in its speed. The rate of species extinction at present is estimated to be between 100 and 1,000 times higher than the average rate of extinction since the beginning of life on Earth. It affects all species, but only a few makes the headlines. The number of vertebrate animals fell by 68% since 1970, and the biomass of wild mammals has dropped 82% since prehistoric time, and 76% of flying insects have disappeared in 40 years. Humans are also modifying their environment through soil degradation, particularly due to intensive agriculture. 75% of Earth's surface is significantly altered. We have lost 80% of the primary forest due to deforestation. This is a little bit Swiss-centered, but our landscape have also changed significantly because of industry. And when we take the train in Switzerland, during a trip, we can count lots of quarries, factories, warehouse, commercial areas. And when I see all that, I imagine what would be the landscape without all of those. It would be lots of nature and biodiversity. And finally, our human activities are sources of pollution, both local and transitory, as in oil spills, but especially global and chronic because of waste, microplastics, pesticides, endocrine disruptors, and so on. We even succeeded putting fire in the ocean. And how can we explain such change? When you think about it, what we need as humans didn't change that much in the last 50,000 years. These needs, it's about food, water, shelter, heating, and social ties. But what changed is now our model of society. It's now based on a globalized thermo-industrial model whose keywords are extractivism, productivism, and consumerism. But it is also good to remember that it's only been organized this way for just over 100 years, and change are also possible and quickly possible. We live on a planet with finite resources, and if humanity wants to continue to enjoy the favorable conditions that allow its survival, it must respect the planetary boundaries, 10 of which are theorized, and we already exceeded between 5 or 6 of them. So when we talk about global change, we think about climate change, pollution, biodiversity loss, biogeochemical flows, ocean acidification and elevation, and land system changes. You may wonder why we've chosen to talk to you about all of this. How are these global changes related to health? This graph, maybe you saw it, oh no, yeah, this one. Maybe you saw it in your studies. It's the determinants of health. So we can see that 10% of them are linked to the environment. That's as much as the one linked to the healthcare system. And the rest, 30% to lifestyle, which is for us in Switzerland, it's our westernized lifestyle, which is dependent on over-exploitation of resources and has a direct impact on human health with the implication of global changes. And moreover, we know that the health system is very polluting. It is quite obvious when we see this photo of intensive care in Switzerland. It emits 4.4% of greenhouse gas emission in the world. And in Switzerland, it's 6.7, so it's even higher. And it's either almost twice as much as air traffic.
So this presentation is not intended to make you despise from humans and medicine, but we choose to show you these images because most of young people suffer from eco-anxiety, around 60%, according to a recent study. So, and we think it's also very important to have like the global picture before talking about solutions, engagement, and what we can do in our medical faculties. Just to finish with a few links between health and global changes. So I think you can change the slides. Yeah. So some of them are quite obvious, such like the effects of heat waves and other extreme climate events or pollutions, but some of more complex such as emerging and vector-borne diseases or the link with food and nutrition. All of these links must be studied from a global point of view, considering the impact of these global changes on mental health and the organization of societies, leading to an increase in social inequities. So now, what can we do? One of the solutions is, this is the graph that comes from the last IPCC report, and that details the different links between climate change and health. And the more dark it is, like the most the effects are important. And when there is a minus, it's like it's getting worse. So I think there are a lot of dark and a lot of minus. So the global health is already impacted by the effects of global changes. And so the solutions. What we propose to you, it's the planetary health concept, which is a new approach, which considers humans' health as interconnected with animal health and the one of ecosystems, and which places at the center of the definition of health the interconnection with nature. It aims interdisciplinarity and the thinking of complex system by studying health as a whole. That is to say that taking into account environmental, socioeconomic, and cultural conditions. Because if global changes are a threat to our health, they are also an opportunity for us to change our behaviors and our society. Yeah. And this concept, I think you know it, it's a co-benefits concept, that some behaviors are good for our health and are good for the environment, such as active mobility, more vegetable food, spend more time in nature, and reorganize our health systems. So if there's one thing that we should remember today, that it's never too early to save lives, and fighting against global changes, promoting planetary health, and taking care of ourselves is already doing this. So I'm really looking forward to the discussion we'll have together. And I let the speech to Iris, I think.
Yeah, thank you so much, Eissa, and Leo as well for presenting that. So before we go on, is there anyone in the room, either virtually or in person, that has any questions on what just has been discussed? Please feel free to raise your hand, and we'll allow you with the floor. Then I think we can move on to the next part of our presentation, which I'm also very excited about. So Mohamed, you already introduced that you do a lot of work when it comes to planetary health and climate change and health. So I would love to hear a bit more from your side. And I think you will talk also about the curriculum design and development.
Yes, thank you so much, Iris. Can you hear me well?
Yes.
Okay, perfect. So when it comes to the curriculum design, and before I start, I'm just keeping the camera off because of the connection. So it's more important to see the slides and hear me than see me. So yeah. So yes, so when we're talking today about the planetary health in the medical curriculum, we need to understand first, how do we do curricula, and what is the curriculum, and how it is designed, and how it is developed, and everything about the curriculum. So in order not to also not dive much in such a technical topic, we would just go as an introduction to the curriculum design and development, and pass through the first thing: why do we plan a curriculum? So if we can go to the next slide. Yes. So the curriculum is more than just a syllabus or a timetable. It embraces all of the learning opportunities, both formal and informal. And this is why we need to work on the curriculum, because it's not just something that we learn in our medical schools and that's it, but it's also something that we need to embrace, something that we need to acknowledge and use in our daily lives, even when it comes to tackling and working on the public health issues. And this also brings us to the next point, which is, what is a curriculum? So can we move to the next slide? Yes. So the curriculum can be seen as an expression of intentions, mechanisms, and context of the education program that requires input from all of the stakeholders, including teachers, students, administrators, employers, the government, and the wider public. The curriculum is part of the individual story of every student as they develop their knowledge, skills, and attitudes. And here, as you have seen in this slide, it's about also, can we get back? Yes, thank you. So as you can see, focused. It shouldn't be just like, for example, the administration focused. It should be also the students focused and based on what the students see that they need in terms of their communities and not just their clinical practice. Because even when we speak about, like, why are we speaking about planetary health even? And what is the link between planetary health and what we're doing? It's because what we're doing is not just pure clinical medicine. We need to work on clinical medicine together with public health, together with global health, in order to be able to deal with the issues of our communities when it comes to the health in general. And this brings us to the point that the curriculum itself, it needs to include what is linked to the clinical practice, like the clinical skills, the diseases, the risk factors, the how to treat a certain disease, how to diagnose it, etc. But we also need to learn how to prevent it. And when it comes to the climate change and when it comes to the environment and the link between the environment and the human health, which is also emphasized in the One Health for those who attended the sessions today of the forum. So many talks about One Health. So when we're talking about the human health, we need to link it with the environmental health. And when we link like the human health with the environmental health and even the zoonotic or diseases or the animals' health, we need to make sure that we're not just treating diseases, but we're also preventing them. And this is the issue, or like from my perspective, this is the issue of our curricula, that it just focuses on treating diseases, but not on preventing diseases. And that's why we need to focus also on the planetary health approach here. So if we can go to the next slide. Yes. So what creates a curriculum? So as you can see here, the curriculum, it's divided into 3 parts or 3 different sectors. First thing, the planned curriculum, what is designed or what is intended by the designers or the people working on the curriculum. What do they want to deliver to the students? However, the other thing is the delivered curriculum, what is organized by the administrators and what is taught by the teachers. So how we are putting this plan into action, how we're implementing the planned curriculum. However, the planned curriculum and the delivered curriculum is not always what is experienced by the students. So the experience curriculum, what is learned by the students. So for example, let's say in my university, they have a list or a checklist of things that we need to study when it comes, let's say, to internal medicine. So they have this planned curriculum, they deliver it in a certain way. And then what I have experienced, what I have learned in the end, if like, let's say, I check my knowledge of the internal medicine, let's say 2 years from now, I will have forgotten so many things. Why? Because the curriculum is based on facts. It's based on just studying by heart certain skills, certain knowledge, and that would be it. And as we mentioned earlier, one of the slides, the curriculum, it's about changing the knowledge, attitude, behavior, skills, not just knowledge. It's not just the acquisition of facts or knowledge. So here, what is or what should the curriculum include? The learning outcomes, teaching and learning methods, how we're teaching the stuff and how the students will learn them. It's not always lectures. It should also include discussions. It should include case studies. It should include different perspectives as well. The context of the learning environment, and the assessment methods, like the type of the exam that we take, the type of the assessment that we go through, in order to make sure that years from now, we're still the competent healthcare professionals that are able to benefit their communities on all levels when it comes to health. So next slide. So here, as you can see, the basis of the curriculum here, like the students are the center, or the students are one of the main pillars of the curriculum, which is unfortunately not the case in many countries, not the case in many universities. Students are even not part of the equation in many universities or in many medical schools. So as you can see here, the students, the curriculum, the health service communities, and everything is benefiting each other. It's just a cycle where everything should work in harmony with the others in order to make sure that it is benefiting the students and benefiting the center here, which is the students. And if we're talking even about the center of the health systems, it's the people, it's the community. So we need to put the people and the community at the top priority. And for us to reach this part, we need to work on the students who are the center of the teaching or the center of the medical school vision, mission, and goals when we get to work on the curriculum. So that's the basis of the curriculum. And next slide. So as you can see here, one of the very good types, I would say, of education is the competency-based education. As I mentioned, it's not just about giving people knowledge. It's not just about the knowledge. It's about changing how they deal with certain stuff, changing their skills, and even changing their conceptions. And even part of the learning methodology, it's about also, when it comes especially about planetary health and climate change, it's not just about learning, but about also de-learning. Because here we're de-learning the rooted beliefs, the rooted norms, the rooted cultural conceptions that says, for example, that environment has nothing related to health, that the climate is not changing and everything is good, and even if it's changing, it's not affecting health. So we also need to go through the de-learning process and then go through the learning process of the planetary health. And in order to do this, we need to do a competency-based education, because it's not just going to someone or going to, let's say, a certain medical school in a certain country, and where it is rooted that the environment has nothing to do with the human's health, and we just tell them, okay, the impact of climate change is 1, 2, 3, and that would be it. No, because they can read it anywhere. We need to acquire the skills of how to change these beliefs and how to build and root new beliefs that are able to benefit the communities when it comes to health. So here we need to work on the desired outcomes, as I mentioned, work on the content, work on like the teaching and the learning methodologies, the assessment methods, and of course the evaluation. Because unfortunately, even the evaluation, it's just done as a routine thing. It's not just done to like improve. I wouldn't say like in all the departments it's this way. Many departments are improving, but equally other departments are not improving. They are just having the evaluation for the sake of having an evaluation, just a routine thing. However, the evaluation needs to be used in the cycle, which I will explain in a few minutes from now, in the cycle that help us to further build and further improve our education, and here specifically our competency-based education. So next slide. So here when we were talking at the beginning, the curriculum design versus the curriculum development. The curriculum design is the process of defining and organizing these elements into a logical pattern. The element when it comes to health, the element when it comes to disease, the elements of planetary health, how we're organizing all these into a logical pattern. However, the curriculum development is the process of implementing changes to a pre-existing curriculum model, which is what's happening in our countries and our universities, and what we're aiming to do with our medical schools after this session, hopefully. And that we get to design the logical pattern of what we want to learn and how we want to learn it, and then develop our pre-existing curriculum models in our medical schools in order to further benefit us when it comes to the planetary health approach. So next slide. Yes, so as you can see here, there is current 6 steps approach to curriculum development. And it starts by identifying the problem, by doing the gap analysis, identifying what is needed and what is the current situation and what are the current gaps. So it just assesses the situation, it assesses the current curricula, it identifies the gaps in terms of the like the global crisis that we're living in. Because we're not just living in a vacuum. Or for example, I'm from Egypt, it's not just me, the Egyptian people, the Egyptian community, and that's it. If we're talking about the climate crisis, if we're talking about the environment, if we're talking about Earth, it's everyone's Earth. So everyone will be affected. So we need to see the situation, we need to compare it to the global situation, and we need to understand our national and even local context and get to identify the gaps. And then also conduct a need assessment, which is identify, for example, the felt need, the expressed need, the comparative need, and the normative needs. These are all called Barshow 4 different types of needs, which works on identifying what the people feel that they need, what the people express by their actions that they need, what is needed in terms of comparing between our existing curricula and the other curricula, and what is needed in terms of the normative standards, the normative needs. There are certain standards that we need to adhere to, and we need to get into these standards. So these are the different types of need that we need to focus on equally, because as you mentioned, we need to be people-centered, but at the same time, we need to be evidence-based and science-based. And based on that, we structure the educational strategies, as we mentioned, after this, after going through this curricula. So we need to identify the proposed outcomes, implement the plan, and evaluate and collect feedback in order to get, again, to the beginning of the cycle, identify if there is any existing new problems, if our curricula build up new problems, or if there are problems that we did not see or we did not identify at the beginning. So it's just a cycle that we need to go through, and it never stops. It never stops at evaluating and collecting feedback. So next slide. So as you can see here, there is like the model that you want to pass to from the existing model that we are having. So as you can see here, this is the SPICES model. And for example, at the moment, the curricula or the curriculum development or even like teaching in general is teacher-centered. It's focused on what the teacher sees is important. It's focused on what the teacher can do or what the teacher wants to do, but not student-centered. And this is what we need to change. We need to be student-centered. We also have the information gathering. It's just about acquisition of knowledge, which is unfortunately the case in many, many medical schools. However, we need to be focusing on problem-based learning. We need to focus on like identifying what's happening in our communities and how we need to deal with it. It's either discipline-based, which is also the case in many medical schools, just focusing on medicine, just focusing on the health. However, while we're also focusing on the health, we're advocating for health in all policies. We're advocating for focusing on the determinants of health. So how can we be advocating for this when we're just focusing on health being existing in a vacuum? So we need to make sure that's integrated by working with other healthcare professionals and even with working with other non-health related sectors, finance, economies, like all the different agriculture, all the different related sectors that are still affecting health and still affected by the decisions. So we need to integrate them into the process. Another thing is the C, which is the hospital-based, and we need to shift it into community-based, but not shift it entirely, of course. We need to learn in the hospital, but we also need to learn what's happening in the community and how we can benefit the communities. We can't just wait for the patients to come to the hospitals, but we need to go to the communities and understand what are the issues in order to be able to deal, as I mentioned earlier, to prevent the diseases and not just work on treating them. And also there is the standard program and the elective, and the standard program is just focusing on the lectures. However, the elective is focusing on learning from the different, learning by different methodologies, by going through the hospitals, going through the clinical rounds, learning through lectures, learning through case discussions, etc. And finally, apprentice-based or opportunistic to systematic. And what does this mean? Apprentice-based is just like shadowing just one person and just learning by coincidence what this person goes through. So for example, I'm going with Dr. X, and this Dr. X goes through, let's say, these 3 by coincidence, and that would be it. So it's not structured. However, the systematic, it's about creating a system, creating a plan for the students, what they need to learn, and we provide them with the methodologies in order to learn these ways, either through shadowing a certain doctor, or either attending certain rounds, or either doing certain discussions, etc., but just not learning by coincidence. And this is what matters the most, is having a systematic way of learning when it comes to our curricula. So finally, in the next slide. Yes. So questions to ask when planning a curriculum. What is the medical schools or training program's vision or mission? What are the expected learning outcomes? What content should be included in the curriculum that has or focuses on a planetary health approach? How should the content be sequenced? This shows how many details or how much detailed we need to be. It's not just about putting like all the different things about planetary health and that's it, that's a curriculum. No, it's about also the details, the sequence itself. What educational strategies should be adopted? What teaching methods should be used? How should the assessment be carried out? How should the details of the curriculum be communicated? And what are the educational environment or climate that should be fostered? How should the process be managed and monitored and evaluated? So as you can see here, the current 6-step approach to curriculum development is applied here through certain questions when planning the curriculum or the new curriculum that you want to implement using a planetary health approach. So before dividing into an example that I see very, together with the amazing team working on this session, that we see very much interesting when it comes to working on planetary health curricula, I would like to ask the attendees, what do you think about your existing curricula when it comes to planetary health? Is it good? Is it bad? Is it hopeless? It can be improved, but like, of course, nothing is hopeless, but just in case you see it this way. But like, how do you see your existing curricula when it comes to the planetary health approach? Are they maybe following these 6 steps I mentioned or following any of the, let's say, the SPICES model or whatever? No right or wrong answers, of course. You're just stating the situation. You can unmute yourself or type in the chat. So.
Hello there, guys. Greetings
Yes.
from Croatia. I'm sorry for being a little bit late. I had my classes. So regarding this topic, I'm really happy to be here with you, all of you. Our curricula is mostly based on teacher's perspective, let's say. So the things you said here, I also support that and agree in all that. So prevention is something we all should work primarily before being doctors afterwards, you know, because there's a lot of things we can impact right now and then maybe later cure them if needed, but we need to lower the impact of things that right now we can impact and change so that we will have the better life later. So what you said, it's like teacher-based, at least in Croatia for now. We have certain professors who do try to implement global health and planetary health, but it's not that much around. That's just my point of view.
Yes, thank you so much, Adriana, for sharing. And unfortunately, yes, it's the case in many medical schools, including mine, that it's very much teacher-centered, not student-centered. And that's why it's the responsibility of me, you, and every medical student who wants to further benefit their communities beyond just the daily clinical care, or even the clinical care itself when they are providing it, that they need to change. So thank you so much for sharing. And Iris, yes.
Yeah, Mohamed, would you like me to share a hopeful story from my university?
Of course.
Okay, great.
Please.
Yeah, no, because we definitely used to be very similar, but if you could go to the spices slide again, was it a few slides back? Yeah, that one. Yeah, exactly. Yeah, so about 2 years ago, so I've now graduated, but I was then still a medical student. I was approached by a professor that works in the Department of Public Health of my university, because they were revising the last 3 years of our medical curriculum. And they approached me actually with the intention to integrate more planetary health into the education, because they've seen a lot of work that students have been doing in it. So that already shows you from the S that they were thinking more student-centered there, which is very exciting. And I can share that now, very excitingly, we have integrated a mandatory education for all master medical students at the University of Amsterdam regarding planetary health. And this is also very much integrated, if I can comment on the I on the slide there. It's integrated with different rotations that we have in different specialisms. So students will be introduced generally, and then when they have rotations, for example, in surgery department, they will have a planetary health related topic that they have to work on, like problem solving on the floor of the department while they're doing their rotations there. And it's also very exciting that now new specialisms, including gynecology and pediatrics and anesthesiology, are following the example of surgery here, and they are also now integrating planetary health concepts into their rotations when medical students are there, and they are creating green teams which are working on a mitigation within their medical practice, in which students are now also invited when they're doing their studies there. So that's an example of how in 2 years really a lot changed, where we had no integration of planetary health whatsoever before, and now we do. And a lot of that design and development of the curriculum was guided and led actually by medical students, myself and others included as well. So that's a very exciting and hopeful example, I hope, for everyone present here as well, that there's definitely a lot of opportunity here.
Yes, thank you so much, Iris. Iris, for sharing this amazing, I would say, yes, hopeful case that we can always implement in our universities. And yes, as mentioned already by Estelle and Leo, like it's never too late to start. And yes, it can happen. It can happen. And like especially with the crisis that is happening, especially with the momentum that is happening. And even like I have seen, for example, in my region, like the focus is going so much now towards climate change, especially that the next COP is happening in Egypt. And like even the one after, there are rumors that's happening in the UAE. So like the region itself is beginning to think that, okay, there is something happening and we need to focus on it. So we need to make even use of these momentum moments. So in order to make sure that a change is happening, even if it's slight outcome at the moment, but it can be like the start for a bigger outcome in the future. So thank you so much, Iris, for sharing this, and for Adriana also for sharing her experience. And now we go to the inspiring, I would say, also framework, or the inspiring initiative that I also would like to present here. So can we go to the next slide? Yes. So the Planetary Health Alliance case, the Planetary Health Alliance has worked on a planetary health education framework, which is very much interesting. And I will share also the link in the Zoom chat, and also Iris, maybe you can share it with the attendees in the room. So like they have worked on an educational framework in order to make sure that we can do something and we can integrate planetary health into different disciplines, into our education, in order to make sure that planetary health is not just something that we hear about like by coincidence, but it's something that we can learn and we can be educated about. And here, first of all, it started with, or like I would first like to present the Planetary Health Report Card, which is also an initiative that has been developed by the Planetary Health Alliance that has these goals as mentioned here in the screen. Operates as a need assessment tool to identify institutions, planetary health strength and opportunities for growth, assemble, synthesize institution-specific information on planetary health resources useful for faculty and students, a global interprofessional community of like-minded students and faculty, track progress in implementing planetary health curricula, and advance the planetary health movement for a healthier and more equitable world. So this is a report card that measures how the medical schools or how the different schools are doing when it comes to planetary health, how they, like, as if it's a rating, I would say, and how they need to progress in these 5 pillars that are mentioned here on the right side of the screen: the planetary health curriculum, the interdisciplinary research in health and environment, community outreach and advocacy, support for student-led planetary health initiatives, and even campus sustainability. So all the different perspectives are included in the report card, which has been done for many different medical schools and for many different countries, I would say. And this is, I believe, is a very nice and a very interesting way in order to begin, in order to identify the problem, as we mentioned earlier in the current 6-step approach to curriculum development. So we need to identify what is the problem, what is the current situation, what are our needs in order to develop our knowledge, attitudes, and behaviors, as we mentioned already, when it comes to planetary health. I would follow this by, next slide, the Planetary Health Education Framework, which has also been developed by the Planetary Health Alliance. And as you can see here, like the process itself, it took 5 steps. And you can see these slides in the Planetary Health Alliance Education Framework itself. It started with a review of literature, ongoing efforts, websites, courses, programs related for planetary health education, in addition to conversations with key stakeholders. And then doing consultations, identifying how is the knowledge, attitudes, and behaviors of the people towards planetary health, how do they feel and how do they see the existing curricula when it comes to the planetary health education. So facilitating a multi-stakeholder consultation, and then establishing a steering committee that will guide the creation of the framework, iterating with the steering committee and contributing scholars to create the different domains, and launch the framework, measure the framework implementation, validate tools that assess the domain adequacy, and develop tools for integration of domains into program development. So as you can see here, these different steps, they are very similar to what we said in terms of the curriculum development. As you can see here, for example, there is the assessment tool, there is the identification of the different key stakeholders in order to be involved in such a process, identifying how to integrate this into different programs, into different curricula, because this education framework is not just for the medical curriculum, it's an educational framework in general. So how can we integrate this into different programs in order, as we mentioned already, like the sequence, the details, when we get to deliver a certain course that has a planetary health approach. And these were the cross-cutting principles when it comes to the planetary health approach in the education. What is the framework, or what is, next slide, please. Yes. So what the framework is and what the framework is not. And this is a very good thing that we need also to acknowledge, and we need to identify while we're working on our existing curricula, identifying what we are, what is our curriculum, and what it can deliver and what it is not or cannot deliver. So as you can see here, what the framework is, it's an organized yet dynamic interpretation or model of the breadth of the planetary health education, a common foundational language for learners and educators around the world, a constructivist proposal to achieve transformational learning, planning tool and approach for institutional curriculum and course design, a recognition of diverse learning pathway. What the framework, however, is not a list of thematic areas, a list of competencies, a prescriptive linear step, or a definite static statements for planetary health education. So here, it showed everyone what the curriculum, or sorry, what the framework is and what the framework is not, in order to be integrated in an informed way into our existing programs and existing curricula. And these were the main 5 pillars of the framework. For example, interconnection with nature, equity and social justice, systems thinking and complexity, etc. So these were the different pillars that we're focused on. And when you get to see the framework itself, it's very much interesting, very much easy to comprehend. So I highly recommend that you go through this framework and see how you can integrate it into your existing curriculum. So this was my part in terms of talking about the curriculum and talking about a successful example, I would say, of an existing framework that can be incorporated into our curriculum. So before we go to the next part with Iris, what do you think about the framework and how do you think you can integrate this into your existing curriculum? Any ideas?
Yeah, we have one hand in the room, so I can pass it to.
Yeah, thank you very much, Mohamed, for the presentation. Not to answer your questions, but just to add that for the European universities, there is also a consensus voted by the AMI, so it's Association for Medical Education in Europe, that was published in 2020, and that also helped creating a planetary health and sustainable healthcare education, and that provides a global view of the teaching and what we can do, how we can do. And it proposes that universities should incorporate a longitudinal curriculum in planetary health by 2025 and beginning in 2022. So it's also a resource that you can use if you want to implement planetary health education into your university, if you work in Europe or not. Like, I think it's quite international too.
And I'm happy that I know it now. It's very interesting to hear this. And definitely that's a good resource for everyone to check and learn about and see what they can do in terms of their own medical schools. So any other inputs or any other thoughts?
Yeah, I have another hand in the room, Carlos. Yes. You don't need to
no, you hear me?
Yeah, but
the owl, so I just turned it off?
Yeah, well, whatever you prefer.
Okay, can everyone hear me in Zoom as well?
Yes, we can.
Okay, thanks. Thanks, Mohamed, for that presentation. I did walk in a little late, so I couldn't hear all of it. I'm Carlos Fyron from the Planetary Health Alliance. I appreciate you sharing some of the materials that we've created, and I want to make a call here for the people in the room and the people in Zoom. I don't know, can you go back to the slide on the steps? Because what one to the right? There, that one. As you see, number 5, we've launched a framework, I think, last year or 2 years ago. I can't remember, the pandemic distorts time, but what I want to say to all of you that are listening and the people in the room is we're now in a process of trying to collect the ways that the framework is being used and examples that people are trying to operationalize the framework. Of course, we didn't want to write a framework and say, well, these are the step 1, 2, 3, 4 that you need to do. Of course, this was more of a guiding framework more than a set of steps. And we are in the initial stages of creating an initiative that will allow to highlight and showcase how are people around the world doing this, right? How are they implementing the framework? So let's say just last week, I was in a university in Barcelona, and I was hearing how professors from the medical school in Pompeu Fabra are implementing case studies that are very relevant to the local environment, right, to the local context of the students that are studying in Barcelona. So, and they were trying to implement the different domains through case studies that are local. So this is a contextual application of this global framework. And so examples like that, I know there are universities that are looking at the framework and trying to, how do we kind of cross-sectionally or trans-sectionally include some of these pillars in education. So if you we're going to create a working group here, but if anyone is interested in working on that and seeing the application, you can see, Mohamed, you're probably a good candidate for that. So I'll ask Iris for your email, but it does seem that an initiative that could bring together people like yourself, among others, to try to create basically an application toolkit, so to speak, right? With full of examples and ways that people are operationalizing the concept of the framework. So thanks again. Thanks. Who's hosting this session? Is it Iris? So thank you all.
Yeah, thank you so much, Carlos, for sharing that. And that sounds like a wonderful toolkit, very, very useful, I think, and practical for everyone that wants to implement things. So thank you for sharing that. So Mohamed, back to you.
Yes, thank you so much, Carlos. I'm very happy that you're here, and definitely I'm in for such an amazing.
So while we're waiting for Mohamed to get back, is there anyone else who would like to reflect on what he has just shared with us? Yeah, Eissa.
Yeah, maybe I can present to you the Geneva we had in the initiative we had in Geneva. That's the local Geneva Health Forum. So you talked that for you in Amsterdam, yeah, the teachers came to you and asked what you could do. The Geneva, it was a little bit the opposite. It was more bottom-up approach that we saw that there was nothing into the curriculum about climate change and health. So we came to see the dean and we said, what can we do to improve this? And they said, you could see the teachers, you could and have a plan, like review all the curriculum that already exists and then make propositions. So that's what we did. And so this went to the creation of a working group with students and teachers. And we are currently reviewing the learning objectives, adding one. We added some mandatory lectures so that planetary health and sustainable healthcare is all across the curriculum from the first year to the 6th year. So you could use the bottom-up approach or the top-down approach. And I think at the moment, both just have to be here, because with bottom-up approach, if you don't have the support from your faculty, it's quite difficult. But like we see that a lot of initiatives are coming everywhere. So the two of these approaches just come together.
Yeah, that's wonderful. That's great. And thank you so much for sharing that as well. And it's wonderful to hear about all the efforts that are ongoing. I'm just checking if anyone else would like to share any reflections that they have, or what do you take away from this? Is there anyone that's already trying some effort in their university, for example? So what we will do is we will move into small working groups. And in your groups, what I will ask you to do is discuss the following 2 points. So first of all, what would be in your situation the next steps to take to include planetary health in your medical curriculum? And what kind of challenges or obstacles do you foresee? And how do you think you can overcome those challenges and obstacles? So this can be a discussion within your group. And you'll have 20 minutes for those. And after the 20 minutes, we would love to hear, you can take like about 5 minutes to tell the rest of us what you have discussed, because then we can all get inspired from each other and learn from each other on how we're going to approach this topic. So I will